Module 1. Overview of Autism Spectrum Disorder (ASD). Definition and characteristics of ASD. Autism spectrum disorder (ASD) is defined as a complex neurodevelopmental condition that typically appears in early childhood and affects a person's ability to communicate and interact with others. The term spectrum is used because the symptoms and severity can vary widely from person to person. Citation: American Psychiatric Association, 2013. ASD is characterized by two primary areas of impairment: challenges in social communication and interaction, and the presence of repetitive behaviors or restricted interests. Citation: Lord and others, 2020. The hallmark features of ASD include difficulties with social reciprocity, challenges in nonverbal communication, and problems developing and maintaining relationships. Individuals with ASD may also display repetitive motor movements, insistence on routines, and hyper or hyporeactivity to sensory input. Citation: American Psychiatric Association, 2013. These features can significantly impact daily functioning and quality of life. Prevalence and statistics. ASD is one of the most prevalent developmental disorders worldwide, with recent estimates from the Centers for Disease Control and Prevention (CDC) indicating that approximately 1 in 36 children in the United States is diagnosed with ASD. Citation: Menner and others, 2023. Boys are approximately 4 times more likely to be diagnosed with ASD than girls, though girls with ASD may present differently, often leading to underdiagnosis or delayed diagnosis. Citation: Looms and others, 2017. The increase in ASD diagnoses over the past few decades can be attributed to a combination of factors, including greater awareness, changes in diagnostic criteria, and improved screening methods. Citation: Hodges, et al., 2020. Early identification and intervention are critical, as they can lead to better developmental outcomes for children with ASD. Citation: Zweigenbaum and others, 2015. Brief history of autism and diagnostic changes. The concept of autism has evolved significantly since it was first described by Leo Kanner in 1943, who identified autistic disturbances of affective contact in a group of children. Citation: Kanner, 1943. At the same time, Hans Asperger described similar behaviors in children who possessed language skills but exhibited social and behavioral challenges, later known as Asperger's syndrome. Citation: Asperger, 1944. The understanding and classification of autism continued to change, leading to its inclusion in the third edition of the Diagnostic and Statistical Manual of Mental Disorders (DSM-3) in 1980. Citation: American Psychiatric Association, 1980. The most recent update, the DSM-5, combined previous subcategories, such as autistic disorder, Asperger's disorder, and pervasive developmental disorder not otherwise specified (PDD-NOS) into a single diagnosis of autism spectrum disorder (ASD), emphasizing the range of symptoms and severity. Citation: American Psychiatric Association, 2013. Key terminology and concepts. Understanding ASD requires familiarity with several key terms. Neurodiversity. This concept emphasizes that neurological differences such as ASD are part of the natural variation in the human population. Advocates of neurodiversity stress the importance of recognizing and respecting the unique strengths and challenges of individuals with ASD. Citation: Silberman, 2015. Social communication. This refers to the ability to use language and gestures in social contexts. Individuals with ASD may struggle with understanding social cues, maintaining conversations, and interpreting nonverbal communication. Citation: Tager-Flussberg, 2019. Sensory processing. Many individuals with ASD experience atypical responses to sensory stimuli, such as being overly sensitive to certain sounds, textures, or lights. Citation: Ben Sasson and others, 2009. Conclusion. A comprehensive understanding of autism spectrum disorder involves recognizing its core characteristics, understanding the variations in its presentation, and appreciating the evolving nature of its diagnosis. As healthcare providers, it is essential to recognize that each individual with ASD has a unique profile of strengths and challenges. This understanding lays the foundation for effective assessment and intervention strategies, which will be explored in subsequent modules.